With a proper Kegel, it is a squeeze and a lift. A lot of people get the squeeze part, they don't get the lifting piece. So usually that's what's missing when I assess people. It's not just a squeeze, it's a squeeze and a lift. We have to be able to lift up all those pelvic organs and hold everything up. Breathing, super important. And that's why I kind of threw that out there. I want to see how many of you held your breath, because that's something I commonly see in clinic. People hold their breath when they try to do a Kegel. And this can actually be quite harmful because it bears down on your pelvic floor. So when you do a Kegel, your pelvic floor works with your diaphragm. So when you inhale, your pelvic floor should relax. When you exhale, that's when you lift and Kegel, you contract your pelvic floor. So when you Kegel, guys, you should be exhaling. Visualization. So this is a really important technique I use in clinic because, you know, the pelvic floor, it's internal. We don't see it. It's hidden. It's hard sometimes to access and find these muscles, right? As opposed to doing just like a bicep curl. It's easy to see. We can access that. Pelvic floor is a little different. So I use a lot of visualization techniques to get people to access those muscles. A common one I use, and this might sound a little out there, but pelvic floor, is thinking about a ping pong ball, shape and size, squeezing it through the vaginal region, squeezing, lifting and pulling up to the belly button. That's kind of a common visual I use. Doesn't work for everyone. Like I have to throw around a couple different visuals, and we have to find kind of the right one that works for that person. But that's a common one that works for women. Last point, like we just kind of talked about, you don't want to be using any other muscles to compensate. So using your bum muscles, using your inner thighs, using your abs, these are all forms of compensating for a weak pelvic floor. When you're doing a Kegel, you shouldn't even know you're doing it. Nothing should move. No one should know you're doing it. Okay, so these are just some key elements that I coach people through to do a proper Kegel. So with that in mind, can you guys try Kegel one more time for me? Just think about these things. Think about the lift, the squeeze, think about the breathing, exhaling, and try to find a visual and let me know if you noticed a difference. So just give it a quick try for me.